and the rare but preventable death from neglect, abuse, or infanticide. For 7 years, Congressman Rush and his colleagues have been steadfast in their focus and belief that this public health crisis must end. The obstacles to reach this point have been formidable. The stigma of the mentally ill mother blocks hearts and minds who don't want to think about the unimaginable. It takes a legislator of deep substance and commitment to willingly and publicly associate his name and purpose with such a previously controversial and emotional issue, which it still is. The United States would continue to lag behind other industrial nations in recognizing even the existence of these disorders were it not for this bill, which will hopefully pass by a huge, if not unanimous, margin today. While certain risk factors and biological changes have been associated with the development of these illnesses, without funding for research and education provided by the Melanie Blocker-Stokes Research and Care Act, these minutes of maternal desperation and isolation will extend to hours, days, weeks, and years, with untold medical, mental, and social health consequences to our society. This is not a bipartisan issue. This is a moral issue. Postpartum Support International, on behalf of American women committed to this cause, on behalf of their children, partners, and families, recognizes with deep appreciation each and every sponsor who has already joined Congressman Rush, and every sponsor who will join him today to truly demonstrate that we care about our nation's mothers and children by offering them a dignified pathway out of this devastating hell and assuring them you are not alone, you are not to blame, and with help you will be well. That help will begin today. Thank you. It is my pleasure to introduce Susan Benjamin Feingold from the American Psychological Association, who has journeyed here from Chicago to be with us today. Thank you, Susan. Melanie can stay right next to me. Today is a historic day, thanks to the efforts and the vision of Congressman Rush and Carol Blocker and all those working to help women during pregnancy and the postpartum period. My name is Dr. Susan Feingold, as you heard. I'm a representative of the American Psychological Association, and it's more than 148,000 members. I appreciate the opportunity to be here. As a clinical psychologist working with women going through postpartum depression, I want to thank Congressman Rush, Carol Blocker, and all those who supported H.R. 20, known as the Melanie Blocker-Stokes Postpartum Depression Research and Care Act. Although it's been more than 6 years, possibly 7, since the bill was first introduced, we have persevered, and now our vision and our dream is becoming a reality. In the words of a well-known author, what we believe to be true and what we believe is possible becomes what's true, becomes what's possible. Today, we've turned a corner by acknowledging that postpartum depression really does exist, and it needs to be treated. In order to help women experiencing this debilitating illness, we need to understand it better, to research the causes, and to find new ways to treat it. Postpartum depression needs to be treated by mental health professionals that are educated about this illness and know how to provide appropriate treatment. H.R. 20 will do just this. As a clinician, I've been treating women with postpartum depression for 15 years now, and more recently have started teaching graduate students in psychology how to identify and treat women with postpartum mood disorders. I know how much damage an untreated postpartum depression can do. Psychologists and those in the mental health field know how important it is to provide early identification and to provide treatment as quickly as possible for a full recovery. We also know how devastating this illness can be for the new mother for attachment with her baby, and for the whole family. This illness has far-reaching effects if not treated both quickly and appropriately. Postpartum depression not only affects new mothers, it also has profound effects on the couple's relationships, the stability of the family, and the healthy development of babies. 400,000 or more women a year are suffering with some form of postpartum depression. It's time to eliminate the stigma surrounding mental health problems. It's time to set aside myths that pregnancy and postpartum period are wonderful for all women. 10 to 15% of women experience depression during pregnancy. 10 to 20% of women experience depression during the postpartum period, or some form of postpartum depression. 1 in 1,000 women experience postpartum psychosis. This is the reality. This is a pivotal moment thanks to the courage of many who believe this could be done and who are willing to speak out on behalf of new mothers. This has been possible to the incredible determination of Congressman Rush, thank you, Carol Blocker, and organizations like the American Psychological Association, as well as many individuals who have participated in this landmark effort. Today, we've reached a historic milestone. New mothers can finally get help with postpartum mood disorders. Thank you.
Thank you, Councilman. I'd like to introduce now Jerry Reed, the Executive Director from Suicide Prevention Network.
Representative Rush, Susan, colleagues, and activists. It is my pleasure as the Executive Director of the Suicide Prevention Action Network USA to stand with you this afternoon. Today, the U.S. House of Representatives is expected to pass H.R. 20, Melanie Blocker-Stokes Postpartum Depression Research and Care Act. We hope the Senate passes this important measure so that this important piece of legislation becomes the law of the land. H.R. 20 provides immediate attention and resources towards one of the most commonly undiagnosed conditions after childbirth, postpartum depression. Melanie Blocker-Stokes completed suicide after a long, much publicized battle with this most severe form of the mental illness. H.R. 20 prioritizes postpartum depression and psychosis by expanding research and establishing grants for the operation and coordination of cost-effective delivery systems of essential services to individuals affected and their families. The bill tackles the problem in the medical trenches, where providers are in a position to immediately diagnose and treat postpartum disorders, and in the research laboratory, where scientists endeavor to understand the physiology behind the illness. SPAN USA was founded 11 years ago to create a way for those who have lost someone to suicide to transform their grief into positive action, their pain to promise, their hurt to hope, to prevent future tragedies. Carol Blocker exemplifies this mission by exhibiting amazing courage in speaking out on the important public health issue of postpartum depression and its potential for tragic consequences. Our tagline at SPAN USA is opening minds, changing policy, saving lives. Carol's willingness to open minds and change policy has led to the passage today, we hope, of the Melanie Blocker-Stokes Postpartum Depression Research and Care Act, which itself plays a key part in opening minds about this devastating illness. Several months ago, I read a book sent to me by Sylvia Lasalandra entitled A Daughter's Touch. Quite frankly, it opened my eyes about postpartum depression and how very real this illness is for so many. Sylvia's honest and candid story was incredibly moving. By the time I reached the end of the book, and Sylvia was improving by the day, I came across a passage where Sylvia described a very special moment between her and her daughter that read, "Just Melina and me, and a flicker of light sparked between us like a flash of starlight." This remarkable spark and feeling that because of an illness took some time to happen is what every woman suffering from postpartum depression deserves to experience. Sylvia was lucky. She had a strong and loving family, strength from her faith community, wonderful support, and after several attempts, found a doctor that understood her illness and helped her get the treatment she needed. The outcome for Sylvia is what we should wish for all women who struggle with postpartum depression. With postpartum depression, there is help, there is hope.